This portion of Local Lifestyles is sponsored by Owensboro Health.
Weight loss can be a real struggle for some people, and they wonder if weight loss surgery is the answer. Bariatric surgeon Dr. Ravi Alapati of Owensboro Health is here to explain what the surgery is and who will benefit. It's so nice to meet you. Welcome.
Thank you, Angie. Pleasure.
So, people come to you and they ask all those questions, is this for me? So who's the ideal candidate?
So as you know, obesity is a huge epidemic we are facing today, and we calculate obesity in terms of, we measure it with a parameter called BMI. It's called body mass index, and it's kind of weight divided by height, and we take both height and weight into consideration and come up with this number, which is called body mass index. And if patients have a body mass index of more than 35, they do qualify to have weight loss surgery. And they need to have some other comorbid conditions, or if their body mass index is 40, which is really affecting their health, then they also do qualify to have weight loss surgery.
What's the best avenue process for folks who are thinking about this? Are there classes or prep classes where they can have a Q&A with someone on your staff?
Absolutely, and again, it's a very involved process. It takes a long time for them to start, and then by the time we get to surgery, it's almost 6 months. So it's an extended process. We have psychologists who will be involved. We also have our nutritionists who will be seeing patients. So it's a long process. If their patient's insurance does cover bariatric surgery, then we bring them in, start the process, and take them through. And it's a commitment we have for our patients for life. And it's lifetime follow-up. We have support groups, and we have an intense preoperative workup, which has to be done before patients get through.
I think that mental preparation is so key, because if you don't change what got you in that shape in the first place, then you'll just go back to where you were.
Absolutely, and it's just a tool. Lifestyle change, as you said, is so important, which involves diet changes, because again, a lot of our life revolves around food, right? I mean, from the time...
As we just saw.
So true. So again, it's exercise, physical activity, and developing a healthy relationship with food is a key component of this, and we help our patients through that.
It's life-changing, and in every possible great way, to feel better in your body, in your own skin. Now, I understand your center won an accreditation of excellence. Tell us about that and how that benefits your patients.
That's so true, because again, being a center of excellence from a bariatric standpoint means that we are providing excellent care in the safest outcomes. So it's kind of a pinnacle, if you will, for a bariatric program to be a center of excellence. And having a multidisciplinary team, which includes our nutritionist, our psychologist, we have an excellent, phenomenal office staff, which, as you know, it's all teamwork. And not only in the office, but also at the hospital. We have a dedicated floor for our weight loss patients, when we have fully well-trained nurses to take care of them. And we have support groups for patients to come through every month, to follow through. And what we find is patients who are very involved doing the support groups and following through do really well.
It's so important. The support groups really are. How can people reach out to you, get in touch with you, make an appointment?
So it's very easy. It's all online. OwensboroHealth.org/bestself is where they can go in, get all the information, and do our online seminar. And once they submit that information in, our office staff will reach out to patients and bring them in.
Thank you so much for being with us. So nice to meet you.
Thank you,
back
Angie.
Again.
Pleasure meeting you.
We'll be back with more Local Lifestyles right after this. Stay with us.
This portion of Local Lifestyles is sponsored by Owensboro Health.